Hi, I'm Amy Vinton. The proposal I put together for you guys is one I find a huge concern. It is improving the orientation process in the operating room for surgical nurses and surgical techs. Research has shown that hospitals easily fall to the urgency to push perioperative nurses and surgical techs through orientation. With the hospitals rushing orientation, they can have many consequences. Some of the most concerning are patient safety issues associated with lack of knowledge and training of the operating room staff. I have worked in surgery for 12 years, and I find that more and more this becomes a concern. Our number one concern in the OR is patient safety. So when new employees are rushed through orientation, a lot of patient safety concerns can happen. To find a better way to, our purpose for the proposal is to find a better way to orientate new nurses and surgical techs in the perioperative phase. Perioperative means in surgery. There's 3 different phases of surgery. There's preoperative, perioperative, and postoperative. So today we'll be talking about the perioperative phase. Patient safety, retention of the staff, and cost effective. A lot of it is retention of the staff. If they feel like they are not getting proper orientation or rushed through orientation and don't get the proper training, they won't feel adequate in their job, so they might leave before their time is up. The intended audience of my proposal, the primary audience is the operating room director. That's who I would be sending this proposal to. Secondary audience would be the operating room educator, since she is in charge of all the orientation process, and then all the new employees that will be starting the perioperative orientation. And that is just a picture of an operating room that I have found that's pretty accurate. Improving orientation. To collect my data, I visited Creighton University Medical Center and conducted an interview with 2 new employees that currently work in the perioperative setting. I also handed out a questionnaire to 5 employees that have been with the hospital for at least a year to find out their thoughts on the current orientation process. My primary research methods was interviewing with new employees, a questionnaire, an internet search of what's required, and the AORN Journal and Guidelines. The AORN Journal and Guidelines is really what a lot of the institutions go to make sure we are following all the steps and rules of how to orientate in the perioperative phase. Secondary research findings, surgical safety checklists. I found that some hospitals have surgical safety checklists that people have to make. Orientation is different in every hospital setting. Not every hospital is the same as far as the orientation goes. And enjoying work, everybody has to be happy when they work, and of course a teamwork environment. And here are my references. I hope you found my proposal very interesting, and I had a lot of fun in this class, and I can't wait till it's done so y'all can see my proposal. Thanks. Have a great day.